Thanks for joining us. I'd like to walk you through basically the whole process from the beginning of care and how you would enter in as a patient and what that lifespan of a patient looks like. So when you come in, you're going to be greeted by our front desk, and we have a wonderful front desk environment. One of the things I can say, and I'm very proud of, is Woodlands Family Chiropractic is a collection of people who care. They do care about you, and they want you to get well, and they want you to stay well. And so when you come into the clinic, we can just really focus and get down onto what's happening with you. So as you're checking in, it's a very smooth, quick transition into the clinic once you get here. We pride ourselves on not having long wait times. So you'll be met by Dr. Wyatt. So Dr. Wyatt, pass that off to you and explain just high level, the evaluation process and then getting into treatment.
Yeah, one of the things I really strive is to get you back during when your appointment was made. So if you are supposed to have an appointment with me at 8:30, I should be in front of you at 8:30. That's one of the key factors. We dig deep into a consultant history, figure out exactly what's going on. We dive into a very comprehensive exam, and then we'll get you back in, sit down. I'll show you exactly what it is that we see on your x-ray and your imaging, and then lay out the very best treatment plan to really get the problem corrected.
So as far as a report of findings is basically, you're reporting to the patient, you're telling them what you found basically on their x-rays and so forth, and then you'll line item out basically what their care is going to look like over that period of time.
Look, we're here for you, okay? Our job is to help you. And so one of the best ways to make that happen is through highly structured care, whether we're seeing you 3 times a week, once a week, or once every 2 weeks. It just depends on specifically what you need at that time. But one of the things that I actually do is I sit down and I show you your x-rays. And any x-rays you've had in the past, or MRIs or CT scans, because it's an amazing scenario that most people have never seen their imaging. All they get told is, well, it kind of looks normal. Or you got a bulging disc or something like that, and they never see what that really means.
So they get the opportunity to actually see what's happening and then what we're going to do. So Dr. Ratcliffe, then take us through then a course of treatment on a day-to-day basis, what people can expect.
Yeah, sure. So first thing, we have pre-treatment modalities. We start off with electrical stimulation, either with interferential current. We can talk more about that. And intermittent traction. So if you are a candidate for that and that is part of your care plan, you will start off with that. And then next we dive into the chiropractic adjustment. So the treating doctor, either myself or Dr. Keys, and in some cases Dr. Wyatt, will walk in and we will go ahead and start to analyze the spine, see what motion segments need to be adjusted for that particular day. And as far as the adjustments, if it's your first adjustment, we are very gentle. We kind of build upon each visit, and so there is that mutual trust between the doctor and patient.
And we recognize that there are preferences. So whatever your preference is, if you want something deeper, if you want something lighter, but we're always going to get to know you and progress that along each step of the way.
We follow up with corrective exercise or functional movement because this is a big way to help start restructuring and remodeling that neuromuscular component of holding the adjustment.
Typically, you're talking under an hour for your care. On a day-to-day visit. The evaluating process, again, you want to account for a 45 minutes window of time, but again, to be respectful of time, we know that time is a challenge these days, and so we try to respect that, but get you the most out of each minute that you're here within the clinic.